We are very, very excited to have our three esteemed guests with us today. That would be Lieutenant Kyle Banderman, Lieutenant Colonel Deborah Engerman, and Captain Scott Johnston. Um, the evening will start off with 15 minutes from Lieutenant Banderman, 20 minutes from Lieutenant Colonel Engerman, and 20 minutes from Captain Scott Johnson. And we'll have 15 minutes for questions at the end. Please, those of you in the audience, you can ask your questions through the Q&A pod in the bottom right, and please feel free to use the chat to communicate with one another. Or if anyone has any technical issues, you can communicate with us that way as well. Um, I guess if Lieutenant Bannerman would like to start his webcam up, we can have him go ahead and start. Just a few housekeeping notes before we begin. If you are looking for CE credit, please let us know rank if applicable, your discipline, in the chat pod as well. And if you are not registered, we'll need your email address along with those other two demographics as well. And just so everyone knows, this webinar will be recorded and we'll be able to post this on our website for others to view afterwards. And without any further ado, Lieutenant, you have the floor.
Awesome. Thanks, Kevin. So I was just going to do a little introduction, tell you about myself, and then I was going to take a little creative spin on things, just kind of answer some questions or generate some questions probably. I'll talk about the 10 reasons I joined, kind of a top 10 kind of thing, circa David Letterman. I'll talk about the top 10 reasons I joined and why I do what I do, and maybe that'll generate some questions and generate some interest in what we do as a uniformed clinical psychologist. Like Kevin said, my name is Kyle Banderman. I'm a lieutenant in the United States Navy. I'm a clinical psychologist. I currently serve at U.S. Naval Hospital Guam. So if you're not sure where that is, you can Google it in one of your other browser tabs. It is 10 a.m. here. So buenas, good morning, half a day from Guam. I did my undergrad work at the University of Missouri in psychology, and then I did my PhD at the University of Tennessee, where I studied gifted and talented individuals and also the psychology of LGBT persons. I accessed the military. I was commissioned through the clinical psychology internship program in the Navy. I did my internship at Walter Reed National Military Medical Center in Bethesda, Maryland. It was a joint environment, mainly Army and Navy. And I came into Guam about a year and a half ago. So I've been an active duty psychologist for just 2.5 years. Sometimes it seems a lot longer, and sometimes I can't believe it's been that long. So it's been quite an adventure. I love what I do. I'm absolutely passionate about what I do. I'm very passionate about what we do in the Navy, very passionate about what we do in military psychology. So I just wanted to share my passion with you. Like I said, just using the top 10 reasons I do what I do, and hopefully some of those align with what you want to do with your career as well. So the number 10 reason why I do this, my clinical interests. I think many of us have an interest in trauma, and that was definitely one of my chief interests. PTSD is arguably one of the highest indications for evidence-based practices, and the amount of training we receive in evidence-based practices in our training is it's just astounding. Awesome training. A variety of different evidence-based practices are shared, and just becoming an expert in each of those is awesome. I also have an interest in, like I said, the LGBT population. And the last several years, that's been something that's been in flux. Even now, with the trans community, that's something that's in flux with the military. And so I definitely appreciate being a leader in that, being able to share my expertise and my research in that with the community, not just the medical community, but also the line community, those people who are in combat arms or in other corps of the military who do other things besides medical, sharing that expertise and giving that guidance to them. My number 9 reason I'm drawn to military work. I was trained as a counseling psychologist in the Division 17 program, so I'm very interested in high functioning individuals, preventative work, things that can be done to keep members and individuals from developing more severe pathology. So this is right up that alley in military psychology. These are very high functioning individuals for the most part. There's opportunity to work with a wide variety of people, but on the whole, the majority of these people are extremely high functioning, but do experience some of the same stressors that all of us experience from time to time. Number 8 reason, I really enjoy being part of a system. One of the great benefits of being a military psychologist, especially active duty, is that you're a part of this huge support system that you wouldn't have if you're an individual in private practice, down to things that we don't think about, such as insurance and billing and support services. We don't really think about that often in our doctoral training programs. Being around so many subject matter experts, being able to go to anyone at any given time, even if that's through the internet. Navy psychologists, we have a Facebook page that we can set up, and we ask people, other providers, questions all the time. There's probably 20 questions a day that come across, and just being able to go to other subject matter experts, even if you're the only psychologist in an area, the networking and the connections that provide is just awesome. Not having to worry about I always had this thought in private practice that I'm working for my patients. I want them to get better, yes, but if I do help them get better, then that's more business that I have to generate after they terminate. That's not an issue in military psychology. There's always more to do. There's always enough to do, and really my emphasis is on getting people better and helping them to achieve whatever their goals are. Number 7 reason, job security. Like I said, over private practice, wherever you have to secure your own patients, being part of a larger system is just awesome. I know that as long as I'm doing my job, that I'm going to have a job, and that I can continue in this job. And there are lots of other opportunities whenever I'm done with it, whenever I want to do something else. But for the time being, I feel like I have the security and I don't worry day to day, especially I can imagine being part of a private sector system or a hospital, having to worry about the hospital business of things. The military is never going to go under. My employer is never going to go under. So just incredible job security that gives you. The number 6, wearing a uniform every day. All joking aside, I was in a fraternity in college. I really enjoy being part of a system and a culture that speaks a common language and that has a common goal. And I do enjoy wearing a uniform every day. I do love that. It's easy when I don't have to pick out anything to wear for the day. I just know what I'm wearing. But at the same time, it is awesome to learn those military customs, those courtesies, what the uniform mean, what this little language, sorry, it's reversed in the webcam, what this little language means. Being able to tell someone's story from their ribbons is awesome. So I do enjoy that, being part of the culture of the military. Number 5 reason I joined, the very nature of the work. I say probably once a day, I can never see myself doing 40 hours a week of individual therapy back to back. That's just not the way I function. I like to have my hands in a lot of different pots. I like to do a lot of different things, including this. I love teaching. I love being able to network with students in recruiting. I love to network with older, more salty clinical psychologists and use them as their expertise and be able to absorb some of that. Any given day, I'm not just seeing patients, I'm doing a variety of things. I was on a submarine last week for the whole week and got to go underway with a whole command and got to see them in action, got to work with them clinically, but more than that, got to absorb what they go through, what their stressors are, and then start exploring how we might help them in different ways. That's a program that's going on in the Navy right now. So that was an awesome adventure. All those adventures come and go throughout our career, and I love that. I love being able to do different things every day. The very nature of the work. Number 4, a jump start to the career. So if I compare myself to my cohort who I graduated with in my doc program, definitely a jump start to what I'm doing independently, being able to be my own independent provider much earlier in my career. I was the first one licensed. And that's nothing that I did. It's just the support that I had around me and the incentives that are given to me to be independent as early as possible. So while they're still, in this phase of jumping through hurdles to finally become a psychologist, I'll give you a hint. I don't know that ever happens. It's one hurdle after another, and you really just push on through your career, and that's great because it keeps reinforcing us to keep doing what we're doing. But I do feel like I was independent much earlier and able to sustain my own work here much earlier. Which was important because when I arrived on Guam, I was the only psychologist here at the time. So um, I felt like I was capable. I felt like all the training that I had through internship and through my doctoral program allowed me to do that. So it was awesome. Number three, benefits. Sometimes it just comes down to money, but it's not just money. It's the training, the advanced training that we receive. So I'm 2.5 years post graduating for my program, and we never want to stop learning. So I'm starting my master's in clinical psychopharmacology. I've been in that for 2 semesters now, so I'm about 40% done with that. Possibly going to pursue prescription privileges, but right now I'm using it to absorb more information about psychopharmacology and what my patients who are on psychotropic medications experience. That's just an opportunity that I've had through the military, and all those benefits that we receive. Being able to be commissioned as an O3 is an awesome opportunity. Definitely some jealousy from our counterparts on the line side of things who are other types of officers. But those benefits are great, and I feel very blessed to be a part of the system and very fortunate for all the benefits that are there. The number two reason, join the Navy, see the world. I am in Guam. I love Guam. It's a tropical paradise halfway between Japan and Australia. And so this is my duty station. I live on a tropical island. My beach is my front yard, literally. It's about 20 feet out my front door. So I love that. But then just being in this forward deployed place has allowed me to travel because the military is big on encouraging you to take care of yourself. We do get a lot of leave. We accumulate a lot of leave that they do expect us to take. And especially in the medical community, they expect you to take care of yourself, and doing that is part of that. So I've been able to travel all across Asia. I'm very excited to continue doing that for as long as I'm in Guam. And then wherever they send me next, awesome. I know a lot of people have a lot of problems with that. Oh, do I really want to surrender over where I live to the Navy? It is important that you have an open mind. My philosophy is I will go anywhere the Navy sends me. My spouse and I are on board with that. I know that's not every family, but it is great if you can be in that boat and you can say, hey, we're willing to sacrifice a little bit for an adventure, and that's what we've done. And it has been an adventure, and we've loved every minute of it. And the number one reason I do what I do, leadership opportunities. I have lots of clinical interests, yes, but I also have a large interest in executive medicine and healthcare business, the operation of how healthcare works. And the military is a very specific healthcare culture. And so how it works is a little bit different than the private sector. It's becoming more cohesive with that. But I'm very interested in how healthcare on the whole, not just psychiatric services, but how healthcare on the whole is delivered to individuals. And I'd love to be a leader in that. And I'd love to be able to make changes in that system and help it to be even more effective. In no other system can you become a leader so quickly. In the private sector, you have lots of people who are trained to be healthcare executives. In the military, we train our healthcare providers to be healthcare executives. And I think that's an awesome opportunity. Who better do you want running your healthcare system than healthcare providers, people who have been on the deck plate and providing those services? So I think that's an awesome model, and I would love to take part in that. And the opportunities that are given to us for training, even early on, are just amazing. So I love everything about that. So again, leadership opportunities is the number one reason I do what I do. I think we're going to have time for questions at the end. That's a brief overview of everything that has really culminated into me doing why I love doing it. I'd love to answer questions individually. Shoot me an email. And then at the end, I'm sure we'll have some questions as well. All right. Thank you.
Thank you very much. Excuse me, Lieutenant Benderman. We really, really appreciate that. Up next, we have Lieutenant Colonel Deborah Engren.
Hi, good evening. I'm Lieutenant Colonel Deborah Archeron. I've had a slightly different pathway to Army psychology. I was actually initially in the Navy, enlisted as a computer programmer. Did about 7 years, and then went back to undergraduate school and finished my undergraduate degree at University of Maryland, doing research with pigeons. So that probably dates me a little bit. Completed entered graduate school in DC at Argosy University, and entered the Army through the internship program at Eisenhower Army Medical Center. Completed internship. I had probably about 11 years of clinical experience as a civilian, doing ABA therapy and designing ABA curriculum for autistic children. Was able to kind of immediately step into working with some Army dependents in that area. That led me to being asked to interview as a faculty member at Eisenhower. I interviewed and was accepted to stay on at Eisenhower for the faculty of the internship program there. Unfortunately or fortunately, right after probably my first or second rotation as a rotation supervisor, I was picked up for deployment. I went PROFIS to Iraq for 13 months with one of the combat stress control units out of Fort Hood. We were centered mid-Iraq through the northern Iraqi border. I spent my time on deployment providing prevention and treatment to about 15,000 soldiers scattered across that area that I was responsible for. I think one of the good things about the Army is that you're given a particular task, but you never know when something else is going to come up. During my deployment, I had the opportunity to work with Special Forces units and some folks from the Jordanian Special Forces to do selection assessment for Iraqi soldiers that were being vetted for potential to be in either the Iraqi Special Forces or in their counterterrorism units. So I spent about a month doing selection assessment in that process. Unfortunately, I also spent some time working with a unit as a result of fratricide. So again, focusing more on the recovery and prevention of long-term difficulties when their company commander and first lieutenant were killed by a service member in their unit. Did my time in Iraq. While I was in Iraq, I had applied for one of the Army fellowship programs. So the Army has 5 or 6 fellowship programs. I chose pediatric psychology. So upon my return from deployment, I PCS to Madigan Army Medical Center and completed a 2-year fellowship and subsequently was board certified in child and adolescent psychology. Applied to become an internship director and was selected and sent to Brooke Army Medical Center in 2008. Served as the internship director, stood up a residency training program there. The Army has looked at the initial assignments for psychologists, which traditionally are in combat arms units as a brigade behavioral health officer. And through a job analysis, we identified the necessary skill sets to be successful as a brigade behavioral health officer, and then divide those skill sets into 2 years, the internship year and then a postdoc residency, which focused on more advanced skill sets to include opportunity for studying and passing EOP and getting licensure before being sent on to their first assignment. Stayed at BAMC for about 5 years, but to include another deployment as a discrete psychologist, served in that role for about 6 or 7 months, and then returned to Brooke Army Medical Center. I'm currently assigned to Amid Stern School here in San Antonio, Texas. Joint Base Fort Sam is where all enlisted, all services receive their initial training in whatever medical profession, and then where our officers get their basic and advanced leadership courses. So the staff that I work with our department is responsible for providing training in evidence-based treatment modalities and a variety of other behavioral health type courses to include course development. Probably, despite or no matter what assignment I've been sent to, the Army always loves to give you an opportunity to excel in some other area. So besides the jobs that I've possessed due to my assignment, I've also been brought in to work on other projects. I spent some time and was selected to be part of the DoD working group to do the toolkit development for major depressive disorder. Been selected to sit on development groups to look at lessons learned from the last 10 years at war and how does that relate to changes or adjustments that should be made in our combat operational stress doctrine and policies, as well as the role of behavioral health in what you might consider early entry into conflict. So what we call role 1, role 2 combat arms engagements, and how do we as behavioral health providers best assist those folks. I've spent probably the last 2 years working on developing additional training packets or coursework to focus on the second half of our mission. We're always obviously engaged in patient care, but the other big part of what we do is focused on consultation with command. That's everything from how do we develop the best teams, how do we ensure that the units are performing at their highest capabilities and capacities. And so focusing on how do we teach non-psychologists, be it psychiatrists or social workers or 6/8 x-rays, the IO skills, industrial organizational consultation skills that they need to have, which is a key component of what we do when we're not engaged in patient care. So a brigade behavioral health officer is expected to spend about 18 to 20 hours a week doing clinical care or behavioral health specific evaluations, but the majority of their time is spent just functioning as a consultant to command, and that's all levels of command, down to the company commander or team lead, all the way up to the brigade commander. So as the first presenter alluded to, the militaries always give you way more responsibility and opportunity than you would ever see in the civilian sector. We expect our folks who are trained very well to go out and figure out how they can best assist any organization in achieving whatever mission they have, whether that's detention operations or combat arms that are in the middle of a fight or humanitarian missions. What is the role of behavioral health and how do we best maximize our resources to reach that? You know, when I left the Navy, I said I'll never join the service again, and yet I actually just hit my 20-year mark of military service. My deployment time, both deployments, probably are the things that I look back on as A, the most challenging, but B, the most rewarding. The opportunity to work with soldiers, and in the joint assignments I've done or joint deployments working with airmen and sailors, providing support to those who defend our country is, again, probably one of the greatest honors, and the ability to be right there with them and giving them the assistance they need to effectively do their jobs has been one of the most rewarding aspects of what I do. So I alluded to at least the entry-level job for psychology within the Army is typically a brigade behavioral health officer. Subsequent to that, or sometimes in lieu of that, the other opportunities that present themselves are really more related to what is that individual interested in and what opportunities are there, be that entering into the Special Operations Command, taking leadership positions within the clinical leadership roles in various clinics, trying to move more over into strategic thinking and strategic leading. I completed a summer fellowship at the Army War College, looking at the role as the Army moves forward and as part of the downsizing, what are the challenges and potential solutions for issues that will face the Army. And having a seat at that table with combat arms officers, senior enlisted, from intel to combat arms to logistics to behavioral health, and writing white papers that are read by the Chief of Staff of the Army staff. I'm sure you didn't read them all, but for 15 people to be put in a room for 5 weeks and kind of given, this is the key topics that the Chief of Staff of the Army thinks are pertinent, and go out and do the research and talk to subject matter experts and bring your skill set to the table, and how do you contribute in that way. Provides a much broader range. I don't think I've ever been bored a single day. Every day is different. Challenges present themselves, if not daily, then certainly weekly, with the opportunity to figure out how you want to contribute and what you would like your career path to look like. And there's a lot of fluidity in that. So that's kind of been my path in the Army. The traditional assignments for psychologists start out at the force com level at brigades. Folks that are not necessarily assigned to brigades, it doesn't mean you won't deploy with a brigade. We have what we call the PROFA system, where psychologists that are assigned to hospitals or clinics within medical command can often be attached to a particular unit. So if that unit goes downrange, then they're going with them. So opportunities present themselves not just by being assigned to a unit, but throwing your hat in the ring. Our senior psychologist just, I believe, yesterday or day before yesterday, sent out an email that said, hey, these are the next opportunities for deployments coming up. If you have an interest, let me know. So if you're not assigned to a combat arms or a force com unit, and you are in a clinic or in a hospital, you have the opportunity to also contribute outside of that setting by volunteering for deployments when you have an interest in those areas. That's really all I have. If you have any questions, please type them in, and I'll be happy to contribute during the Q&A portion.
Thank you very much, Lieutenant Lundgren. Right now, we are preparing Captain Johnson's PowerPoint, and he will be up in just a moment. Please feel free to ask any questions in the Q&A pod on the bottom right, and we will organize them and get to them in the Q&A section at the end.
And so is my audio live currently? This is Captain Johnston.
You are live.
There we go. So I guess you're going to be controlling whether to go back and forth from PowerPoint to my webcam.
Click and the start my webcam in the top right. It should come through. Very, very good.
Okay, great. So you can save my slides till later on. I think we just go with the video feed initially. And then I'll go ahead and get started. Thank you so much for the opportunity to kind of talk to all the students here. Thank you to Kevin and the rest of Division 19 that have been putting this on. I think it's a great opportunity, certainly in my capacity as special leader of Navy clinical psychology. I get a chance to talk to lots of students, and this is a great way of kind of amplifying that and talking with a lot of people at one time. So thank you again for this opportunity. My hope is to talk a little bit about 3 different things. Talk a little bit about maybe some goodness of fit about at being a clinical psychologist in the Navy. Talk a little bit about kind of my experience and my time in the Navy as a potential template of what a career could look like. And then talk a little bit, if we get time, about some of the biggest changes and the most significant part of what's going on, I think, across all 3 services as far as embedded mental health services and operational psychology. So that'll be the goal to cover. In my current role, I mentioned that Captain Scott Johnston. I'm a clinical psychologist, currently the specialty leader for clinical psychology. That's the same thing as the consultants in the Navy and the Air Force and the Army. And basically the special leader's job is to be the senior psychologist for the community and advise on whatever kind of policy issues there may be, to be the advisor to the Surgeon General about whatever issues may come up regarding clinical psychology. And then what I like to do the most is to advocate for our community. So helping to make sure that people get the most opportunity they have for promotion, making sure that our people are doing fulfilling, rewarding jobs, and really doing whatever I can to advocate for the community. So it's one of my best collateral duties, even though it's officially just a collateral duty, but is to being the specialty leader for clinical psychology. My day job is to be the director for the Naval Center for Combat and Operational Stress Control. So I have to give my little plug here to, if you want to see what we're doing at NCCOSC, please go ahead and check out nccosc.org, and we're out there that you can check us out and Google us at NCCOSC and see all the things that we're doing there. I think one thing we get a question quite often is, well, what are you looking for to be a Navy psychologist or a military psychologist? And really the thing is, we're looking for the best goodness of fit. There's really not good or bad kind of issues. It's what is the kind of qualities that make this pairing work well together. And three things I always kind of talk about that seem to be the most crucial to deal with if you're considering being a military psychologist. And certainly the colonel and the lieutenant mentioned this as well, kind of alluded to it. But certainly the first thing I think is being flexible. You never know. When I come into my job, and Lieutenant Bannerman was talking about this, you never know what to expect, what's going to be on your plate for any given day. And that's going to change quite a bit from day to day. And have that flexibility to be able to kind of adjust fire to whatever the situation may be arising your particular day. But it also goes broader than that. It's also looking about across an entire career, being flexible to where you may go work, what populations you may be working at, what geographical positions around the world that you may have, the quality of your food, depending if you're deployed or not. The comforts of your surrounding may vary if you're in garrison back in San Diego or if you're downrange in Djibouti, Africa. Things are going to change a little bit over time. So being flexible is an important aspect. Being adventurous, I think, is an important aspect as well, because the job, as we mentioned, is always going to be changing, always going to be different, and it really truly is an adventure. I think we even said, yeah, it's not a job, it's an adventure. And it's really true, because every 3 years you're going to be starting a kind of basically a brand new job and a new location, taking on new roles and responsibilities, and really it is really a venture every day wearing the uniform. And the colonel also mentioned this about the idea of it being having responsibility. It is amazing how quick we pile on a lot of responsibility onto our very junior lieutenants. You heard what Lieutenant Bannerman's doing over there in Guam. Very quickly, we give people leadership opportunities, making real important decisions about fitness for duty for various service members, important collateral duties, legal implications, lots of different very large jobs that they're going to have to do relatively soon. So if you like the idea of having increased responsibility really quick in a career, this is also a good fit. So those are kind of the general broad strokes and kind of looking at it, goodness of fit for thinking about coming into the military. I think, again, as the other two presenters have done, kind of talk about my path through the military might be a way to kind of give a sense of what a career opportunities might be, and we'll give you a little sampling of what a career could be like in the military. I've been in the military now, active duty, for 22 years. I started in 1993 as a intern here at Naval Medical Center San Diego. So I came in as a pre-doctoral intern, which is the group that we get the most of psychologists through in the Navy is through that program, even though we have the other accession programs as well. And so after a fantastic year of an APA accredited internship here at San Diego, I was accepted into a Dewins Fellowship right off the bat. And Dewins is a great opportunity that we have as military members to go spend a year or two learning about a specialty within the field. We definitely train generalists to go out and do general psychology, but we do have this opportunity to get specialized through our Dewins programs and through these fellowships. We currently have fellowships in specialties such as pediatrics, neuropsychology, psychopharmacology, health, operational psychology, and a variety of other ones as well. So I decided to do a pediatric psychology fellowship. I wanted to go to a place that I'd heard is pretty good, so I put in to go to Harvard Medical School in Boston, and went there for a year and had a wonderful learning opportunity. So for a year, I had a chance to wear civilian clothes and really just absorb all the knowledge I could there at Harvard. It was a wonderful experience. As the military loves to do, they love to give you benefits, but then they want their payback. So after doing my year in Boston, I had to do my 3-year payback tour, and I was sent to Yokota Air Force Base in Japan, outside of Tokyo, Japan. And this was a wonderful opportunity. Again, with getting responsibility early in a career, I was the department head of a EDIS program, which is basically a program that handles all the special education for our kids that are overseas, so social workers, occupational therapists, psychiatrists. I ran this entire department, and was able to utilize my pediatric experience as well as having that responsibility early on. Being stationed overseas is a wonderful opportunity that anybody on military service would get to do, living out in the community, interacting with the locals, traveling all throughout Asia, and had trips to Singapore and Australia and Thailand and Korea and Japan, throughout China. Lots of great opportunities there. So after that tour there, then I had the opportunity to come back to the Naval Medical Center San Diego to do another child staff psychologist rotation, which is here, and I had a chance to work with the dependents here in the San Diego area and really hone and utilize my skills as a pediatric psychologist. While I was here, I had my first opportunity for a deployment. I've had the pleasure to serve for 5 different deployments throughout my history, and my first one was on the USS Constellation, an aircraft carrier out of San Diego. At that time, we were just starting to put psychologists on carriers, and it was a great opportunity to go underway for 6 months, travel around the world, truly an adventure, and bring mental health services directly to an aircraft carrier. And this was kind of a new idea at the time, to actually get mental health out of the MTF, the military treatment facilities, and getting it to the deck plate, to actually get it onto aircraft carriers. So I did a lot of embedded work there, which I'll talk about more towards the end. After my tour here in San Diego as a child psychologist, I had the opportunity to be the presidential support psychologist in Washington, D.C. This was a fantastic opportunity to be involved in the presidential asset allocations and dealing with all the Marines that guarded presidential assets. So my core mission there was to evaluate through assessment selection all the Marines that were going to guard presidential assets, and then monitor them and treat them if necessary. So at the time, I thought this seemed like a really interesting kind of fun job to do. And then it wasn't until I got into the job that I really appreciated the gravity of this job. So I would have very high-ranking people within the White House say, can this Marine carry a rifle next to the President of the United States? And so I was called upon to make those types of calls. It goes to say that I had some sleepless nights worrying about some Marines that I'd made that call about. But thank goodness you didn't see me on CNN when something unfortunately happened, and all turned out well. But also in that capacity, so since I was at the White House, I had the opportunity to be a White House social aide. So I was there for state dinners and different dignitaries. I served as an extension of the President and the First Lady at White House events, which was a great opportunity. I was co-located with the Presidential Helicopter Squadron, HMX-1, when I was at the White House, and so I had the opportunity to travel with the President throughout the world with the helicopter squadron, and it was just amazing to look behind the curtain and see, what goes into planning and executing a presidential trip. When they're loading up all the limousines, loading up the helicopters, flying them all over to whatever forward designation they had to be with, and they had a psychologist on board to make sure that the psychological health of all the Marines that were flying the President, that were guarding the President, were intact. And so that was a great opportunity. After that, this was the only time that I didn't get my first choice in my next assignment. I really wanted to go to the Naval Academy and teach psychology to the midshipmen. I did not get that opportunity. I had to get my second choice to go to Hawaii, so it wasn't such a bad trade-off. So then I went to Naval Hospital Hawaii and worked with the Marines and the sailors over there in Pearl Harbor. This was a great opportunity. I had started to get some leadership skills there, working as a department head, and this is when the war was really starting to ramp up. And I remember the 3rd Regimental Commander over at Kaneohe Bay sat me down one day and said, "Hey, Doc, I got these Marines that are coming back from overseas, and I'm not sure if they're really in the right space they need to be in. What can you do to help them out?" So I started developing a program to transition warriors back from war, and during that time I did 3 combat deployments to Iraq, which were some of the most intense experience I had in the military, but also the most rewarding. To help these true warfighters transition back into garrison after being in some very intense situations. So I had a chance to deploy forward with them into Iraq. I was in Haditha, Iraq, Fallujah, and Ramadi as well. So that was when I really started working with the concept of being an embedded mental health provider, because I was there responding directly to the company commanders. After a while, I came back to the Naval Medical Center San Diego, did some more traditional MTF jobs of this being the senior medical officer for a fairly large department and directorate. Then I was the department head out at the Substance Abuse Rehabilitation Program for a while. And then I transitioned to the Bureau of Medicine and Surgery into my current job, where I'm the director of the Naval Center for Combat and Operational Stress Control. During this time, I did have my 5th deployment, where I was able to go down to Joint Task Force Guantanamo Bay, Cuba, which I'm sure we've all seen in the news. Actually, it was interesting seeing the president speak about closing Guantanamo Bay, Cuba today. He was saying that we have 91 detainees left there, and he's doing his best to kind of have some plan to close it down. It's a very interesting place to be. I heard somebody mention some of the Biscuit mission. We take care of the detainees, psychological care. We also take care of the guards that are down there and the rest of the staff. A very interesting place to be a part of that mission. Actually, I did some research while I was down there and found out that the stress that the guards and the staff were under was just as intense as forward deployed infantry Marines in the middle of combat. So don't let anybody tell you it's an easy place for assignment just because it's in a tropical paradise. It's actually a very, very challenging deployment, and some of our research supported that. Then I'm now wrapping up my job here at NCCOS the next few months, and I'm going to be heading over to work with the SEALs at the Navy Special Warfare Group 1, working again with the embedded program over there. So that's kind of just a sense of kind of what my career path has been like, to give you a sense of some of the types of jobs that you can be in. You can see there's MTF jobs, military treatment facilities, opportunities for advanced training through our DUINs. There's opportunity to serve overseas, opportunities to serve with operational units. So that's kind of a gist of what types of potential jobs you may get into if you join the military. Some of the other kind of general kind of highlights that I usually get when I talk to students, I'll kind of throw it out there in case those questions are out there. We definitely train generalists. So if you want to become the best subject matter expert in neuropsychology and treating brain trauma, probably the military is not the place for you. We really want people that can take a fundamental generalist set of skills and apply that in many, many, many different settings. We do have ongoing deployments currently. So we have deployments to Guantanamo Bay, Cuba, to Djibouti, Africa, and also we have a lot of organic deployments with our embedded units, such as the SEALs and the Marine infantry units. I talked about the DUINS opportunities, but those are some great opportunities that are out there for our individuals. And yeah, we really try to get a sense of what's going on within our community and how people are doing and feeling about our community, because we're obviously dispersed all around the world. And currently, at Navy Psychology, we have a little bit over 200 billets around the world, and a little under 200 personnel that are meeting that need. And out of those, we found that most people found that they really much enjoyed their time. They felt that they were very satisfied with their job. The vast majority felt satisfied or very satisfied with their job. About 81% of the people that had deployed found that a very positive experience as well. And it's good that we kind of constantly try to monitor and see how people are doing and feeling about our community. So what I think I'd like to do is I think I have 5 minutes left, is talk a little bit about the biggest transition I've seen in the Navy. So if we can switch to the PowerPoint slides. I don't know if I can, if we go to the first one, the embedded model. So one of the biggest changes I've seen happen within clinical psychology in the last 22 years is this transition from a hospital-based setting into operational basis. I guess, so I do the forward. There we go. So we've seen this really expanded mission of what's happening within psychology. 10 years ago, people would expect that they would come and work at an MTF for their entire career. And the only thing that made them really different from the person working up the street at Kaiser was the fact that you always knew exactly what you're going to wear every day because you're going to wear that uniform. And that has drastically changed. Because starting in the mid-90s, we started realizing that we had a real place in the operational force. And so what we did is we started embedding people onto the aircraft carriers was the first place we went. And it's built since there. We're now on every single aircraft carrier across the entire U.S. Navy. We have Oscar providers, which are embedded into the Marine infantry units. And we have a lot of units also assigned with the Naval Special Operations or the SEAL teams. So we're seeing this is where the vast majority of our growth. Navy medicine is shrinking along with the military in general, but Navy clinical psychology continues to grow. And I think it's because we really, the line leadership sees the important attributes that we bring to the field when dealing in completing their mission, and they want more of us. So everywhere we go, they want more psychologists. And so here's really the expanding mission. We talked about some of those right there. So really kind of to juxtapose those, so there's a medical model, which is we're kind of more familiar with. It would be more similar to your working at a Kaiser or a regular outpatient unit. But then we're seeing more and more people getting embedded into our forward operating units. And so some of the key aspects of this embedded model or operational psychology is that we're, keep losing my thing there, is we're really basically using the PI principle. So that proximity, immediacy, expectancy, right there at the tip of the spear is really what breaks out embedded psychology. Just hit some of the highlights here. Some of the setting is very different when you're embedded into a military unit. As opposed to being assigned to a medical chain of command, you have actually a line unit chain of command. When I was in Ramadi, I reported directly to the 3-8 regimental commander, and he was, important to him was what was going on within his unit, and that was what was important then to me. There's a direct connection to the mission. You attend like the battle update briefs, and you know what's going on within that particular unit, and you can better address and meet those needs since you're embedded with them. To become part of the unit, you need to do what they do. So taking some time walking around on posts, going out on patrols, hanging out in the gym, going on convoys with them, whatever it might be, so that you can kind of break down those walls of stigma and they see you as just one of them. The referrals come from very different sources. In a garrison setting in a hospital, you may just get regular referrals from specialty care and primary care. But referrals, when you're embedded, will come often from the individuals. They may just kind of come up and ask you a question off the cuff. The chain of command may ask specific questions of you. The chaplain may be involved. You work very closely with them when you're embedded. And then also certainly some come through the medical units as well. The actual interventions that we're doing, I mean, you're on 24 hours a day. You're with that unit on the ship, downrange in Afghanistan, wherever you happen to be. And there's a greater focus on prevention as opposed to treatment where you have in the MTF. So a lot more on prevention, looking at issues of sleep, operational stress control, fatigue, managing stress, those types of issues. There's a lot of informal consultations. You may just be working out with someone in the gym and they may ask you a question about how they're sleeping or their marital relationship or something that might be going on. We also often bring on organizational consultation at this point. So the commander will often ask me, hey, there's some issues with a leader there. Can you go check it out? Or how's morale doing at this particular company? Go check those things out. You often work in a group setting. You're always looking at fitness for duty is an issue. And you also certainly do some treatment as well. One quick sea story about this. I know when I was in Fallujah, I was taking the rounds on the post and I ran into this one corporal that I was talking with, and we're just sitting there talking, and as long as you're not engaged in firefights, it's usually actually fairly boring. And I was talking to him, and he said, "Hey Doc, why are you here? I've been having problems sleeping for the last couple of days." I said, "Oh really? What's been going on?" And he said, "No, everything seems about the same. Just been out on regular patrols and stuff." And I said, "Well, 2 days ago, did anything happen in particular?" And then his face lit up. And he said, "Well, yeah, actually, I was shot a couple days ago." And I was like, "What? You were shot? What? Tell me more about that." And his face lit up, and he was very excited, and started talking about how he took 2 rounds of 7.62 right in his SAPI plate, and the SAPI plate kind of exploded, like it's supposed to be, and he just got a couple little bruises. And I looked at this corporal and I said, "Hey, do you know you just had a near-death experience?" And he's like, "You think so?" And so we started talking about this, and the idea that this was a really significant event, and actually it brought up some issues of some unresolved death in his family, of some people that he loved and cared about. And so we started talking about that over time, and it slowly increased his sleep, and he got better. And I made sure the next couple of days when I was walking through the post that I had a chance to talk to him. And so I just wonder, I think that's a great example of what a psychologist embedded can do. Because if I wasn't there, and it wasn't me, if there was any psychologist there that was talking to this guy so early on when he just started to have symptoms, what happens if that psychologist wasn't there? How bad would things have to get before he was medevac to a unit in the rear? And then he's stigmatized by his unit having to be pulled out and everything else that's associated with that. So I think that really is a key example of the benefit that we can bring. Okay, I lost my little thing. Next slide. Looking at the pros and cons of this, clearly it supports those PI principles I was talking about. It's a real force multiplier. These line unit commanders want to know that you're there to make sure their units are going to stay in the fight. And that's what psychologists do in this role. You're part of the team. You break down all those walls of stigma. You're no longer the wizard that they call it in the Marine Corps. You're now just one of them. "Hey, Doc, help me out." Leadership loves it. They love having that kind of capacity to look at the psychological health issues. There's also obviously some cons on this. There's not enough of us to be down into every single company where we might want to be able to serve, so that there's a little bit of issue of that. Compassion fatigue. I went to way too many funerals than I ever want to be in my whole life, saw more death than I ever want to see in my whole life. And so we as psychologists are affected by that as well. And there's the compassion fatigue and your own trauma that you're going to have to deal with. And there's also physical danger. When I'm out on convoys or out on patrol with those Marines, I'm putting myself at risk. And we're a pretty big asset to have out there potentially at risk. So there's definitely pros and cons, but on balance, I think it's definitely a very important aspect, and really a big way that you're seeing psychologists use within the military. And this is, line leaders talk a lot about what is helping them meet their mission, and more they're saying that psychologists are crucial to meet their mission. So next slide. I think that's it. So I think I'm up in my 20 minutes. So look forward to the Q&A, but thank you for the opportunity to do this. I hope you consider a career in the military. We all have different pros and cons across the different services, but all in all, obviously, I have enjoyed my time here. Was really surprised that I stayed here for 22 years. I sometimes feel like I'm acting like a recruiter here, but it's just me, and I know I've experienced a great time, and it's all just about goodness of fit. So if it's a good fit for you, I hope you give it a shot. And my email is on that first slide. So if you have any additional questions, please feel free to email me. So I think we'll turn over now back to our host.
Thank you, everyone. We really appreciate all three of you giving us your time to talk. We apologize about the technical difficulties briefly there with the Q&A pod. We are trying to solve it. We have a few questions come in so far. The first one from Amelia, and this is for all three of our presenters. And it's, what are some developmental activities in regards to officership and professionalism for junior officers in the reserves to be thinking about in order to advance in leadership positions? reservists may have more limited opportunities to engage fully. So within that context, what may be some opportunities? I apologize if my microphone cut out there. The question was in regards to what are opportunities that reservists should be looking for to advance in leadership positions.
This is Captain Johnson. Unfortunately, I'm the special leader for the active duty force, so I don't work too much with the reservists. I know Commander Basso is the assistant special leader for reserve affairs, and he'd be a great one to ask about that.
We Are there any other responses from our other two presenters? And this may include during HPSP reserve time. Colonel Ungren, I believe is your microphone still muted? Still can't hear you. We apologize, everyone, for the technical difficulties.
Kevin, maybe I can answer the next question while we're
Okay.
getting Lieutenant Colonel Langeron set up.
The next question comes in from Carolina. For any of the branches, what do medical officer responsibilities look like in terms of duties, formation, being part of the unit, leadership?
This is Captain Johnson. If I fully, are you meaning physical training there as part of that and formations? So again, I think this speaks to the issue I was bringing back before. If you're working at a medical treatment facility, it's very similar to any kind of hospital you may be working at. When you're embedded in a unit such as our Navy Special Warfare, stationed on a carrier with the Marine Corps infantry units, there you're actually part of that unit. So you're doing formations, you're running the PT with them, you're an active viable person connected to all the activities that that particular unit will do. So you're fully integrated. And I think that's one of the unique aspects of it. You're not kind of seen as the outside expert. You're actually part of that unit.
Okay, thank you. From either of our other two presenters?
I will say one of the cool opportunities we do have that is more geared toward organizational leadership and being an officer is that the Navy has behavioral health technicians. Getting some feedback, but the Navy has behavioral health technicians, and then the Army has 68 X-rays, I believe, who are enlisted now, who are trained as psych techs. So in my clinic, they do my psychological testing. So I oversee them as psychometrists. They do my psychological testing. They also do intakes into the clinic. So they're trained in a diagnostic evaluation, much like you would be in graduate school. And so I oversee them from a clinical standpoint, but also from an officerial standpoint. Yes, participating in PT with them, treating the department, even though it's a clinical department, treating it as a unit. And so ultimately I'm responsible to my sailors and leading them and helping them reach their career goals, which may be in the military, but it may not be. Maybe something in related to psychology, or it may be unrelated. But helping them develop them into leaders is a big part of our job as well.
We still can't hear you. All right. Not sure what the technical problem here is. We can move on to the next question. And I'm going to assume this one is more geared towards our Navy presenters. The question comes from Katie Fry. Could you share a little more about what a psychologist does when they serve on an aircraft carrier?
Okay, I think I'm back up. It's one of the initial embedded platforms that psychologists were on was the aircraft carriers. And they first were asked to go on the aircraft carriers because they were spending hundreds of thousands of dollars on medevacing sailors off the ship to evaluate for suicidality potential. And so that was really the only initial driving force of them, was to have them to kind of handle the suicidal patients they had on board. But what we found over time is that the psychologists brought such an additional set of skills to deal with prevention and organization and group consultation. So they really quickly realized that we brought a lot more on board. So as I kind of alluded to before, when you're on an aircraft carrier, you're reporting directly to that captain of the ship. And so you're there to meet whatever he wants. So you're doing what fitness for duty. Can this guy do his job? Can that electronic mate or that operational specialist, can he control his computer system? Can he perform his jobs in a safe manner that's going to contribute to the mission? Or does he need to leave? Does he need treatment? Does he need to be medevaced? Can he do his job? So you're constantly doing those kind of fitness for duty evaluations. And then part of that may be, well, he can't do it right now, so I need to put him on like limited duty and treat him. And he may have an adjustment disorder that he's in with some relationship stuff back home. And I can work with him in the context of being on the ship and get him back into his job. So really what you're doing all the time is kind of assessing, can people do their job, and getting them back to doing that job all the time. The nice thing about being embedded is that, again, you're kind of breaking down the stigma all the time, and you're working on prevention issues. So wherever you are, walking the P-way, being up on the flight deck, wherever you happen to be, you're representing and being able to deal with psychological health issues. I do have to say, though, while you're on board, you do get to do the fun side of things of being an aircraft carrier, is actually seeing how these places work. It is absolutely amazing to see 5,000 men and women on an aircraft carrier launching, all these sorties of airplanes off the deck of the aircraft carrier. It's amazing to see night operations, to see these guys coming in pitch black, landing on this deck that's pitching up and down in the waves. Unbelievable to see. And then as a psychologist, being part of the group, we also then get to fly with the unit. So I had the chance to. I had about 24 traps on and off the aircraft carrier. They did barrel rolls in the S3s and various aircraft. So you get to experience what it's really like being part of the aviation departments as well. So all in all, a wonderful experience. Also, then you're there for ports of call. So you pull into Dubai or Australia or Singapore, wherever you may be, and you get to go and obviously help monitor and maintain the psychological health of all the people that are out there, sometimes making some bad decisions, but you also get to enjoy those ports of call as well. So all in all, it's a really fantastic experience.
Thank you. That sounds great. We are going to try and see if we can get all three of our presenters' webcams up at the same time. It might make this a little bit easier. Our next question is from Brooke. And she asks, how much of your time is spent in session with the family of military personnel and their children?
So I can answer that, a little bit. It'll expand on what we do here because feedback. The Navy and the Army as well, we have lots of services available for service members. So if we're talking about family counseling or marital counseling, we have other services available because clinical psychology, especially in the Navy, is definitely geared toward the medical model. And for those things, evaluating what is going on with the service member, but then treating those conditions that are severely impacting that individual's ability to function in his or her job. And so for those counseling type issues, if it's marital therapy or if it's family therapy, we have lots of other resources. We have Fleet and Family Support Center in the Navy. It's an Airman Support Center, I believe, or something similar. In the Air Force, Army has something similar. And so they can use those services for family counseling. Now, if we're talking about it as an adjunct to clinical therapy, that can happen if it's indicated. And so I've had family members come in every so often if it's clinically indicated for that specific service member, whoever my patient is, and seeing them as an adjunct to therapy. Not to mention that our duty is also to treat those family members. So at our clinic here on Guam, we see active duty, but we also see dependents. So that's spouses, that's children, and then we see retirees, people who are retired from the military but can still access military benefits. So you are seeing not just active duty in an MTF, you're seeing civilians as well who are either retired or who are connected to an active duty service member, but that person is the identified patient in that instance. And so the counter is also true that you may invite the active duty service member in to discuss some things going on if it's indicated for their therapy.
Lieutenant Bannerman is obviously absolutely right, but I think it's important to think about the different settings you're in may deem whether you're able to see the dependent care. So he's obviously stationed in Guam, so there's not much of a robust network. So if you're stationed overseas in Rota, Spain, Sigonella, Italy, you're going to be taking care of the entire military family there. But in more of the metropolitan areas in the continental United States, we don't do as much dependent care as they do overseas. and the emphasis really is the first line of attack is for the active duty members. So for example, here at Naval Medical Center San Diego, we're currently seeing only 80% of the active duty force. We're even having to send some of them out to the network, and we have a very, very small child and family unit here. So we see maybe 5–10% of the total cases, and most are seen out in the network. We do have some non-medical providers within the Navy. We have the Fleet and Family Service Center, the Marine Corps Counseling Services on the Marine Corps side. So non-medical providers that do provide counseling support, as Lieutenant was mentioning, to our families, which are done kind of outside of the medical model. So it's a little bit of a mix there. So unfortunately, we don't see as many of the family members CONUS as we'd like to, but certainly you can see that overseas.
Ma'am, we can't hear you still.
I'm guessing that it's
Still
the
no
same thing in the
microphone
Army.
on. Our next question from Grant Beeman. Someone is asking Lieutenant Colonel Enderman to talk a little bit more about how fellowships work currently in the Army.
As she's typing, we'll give the multimodal answer, getting the written version there from the Army. As far as the Navy, we do have those DUINS opportunities I spoke about. So, and those are usually open to junior officers. So lieutenants, lieutenant commanders, 03s, 04s are able to take that year or 2 years off and completely study independently out at various academic institutions around the world. And we cover a variety of different areas, mentioned pediatrics, neuropsychology, psychopharmacology, forensics, health, so a variety of different specialties that are available to our officers.
We appreciate that, Captain Johnson. While she's still typing that one out, we can move on to the next question from Nick Marie Soto, who is a second year in her PhD in clinical psychology, and she's interested in participating in a summer internship or externship, and she's looking for more information. If either of the three of you have any information on that, we can also she can also reach out to the Student Affairs Committee, and we can fill her in as well.
I'm sorry, you said she's HPSP. Is she what branch of service?
Sorry, she's in her second year of her PhD in clinical psychology.
And I think you said she was HPSP, but which branch of service?
Sorry, I did not. It does not say if she's an HPSP or not. She says that she's still a student and not an HPSP.
And I'm confused. She's looking for what kind of summer opportunity she can have in the military?
I believe so.
I hate to keep speaking up, but I'm sorry, I don't really fully understand the question. If she's a civilian and not in a military program, then it would be, impossible for her to do a summer, what we call the summer cruise, for people that are either at the uniform school, USU there at Bethesda, or on HPSP. We have opportunities for them to have military exposure during their summer cruises. But for civilians, then those opportunities aren't there. But certainly there are. If you're thinking about a career in the military, certainly getting exposure to certain practicum experiences would be very beneficial if you're ultimately going to apply. For example, working at a veterans hospital is one of the best places. We see that on our applicants, and those are usually very competitive applicants. If that because you can work in a military treatment facility, that is as great as well. So if they can get some generalist outpatient experience, particularly with veterans, that'd be the best thing they can do to prepare themselves for coming onto active duty.
Thank you, Captain Johnson, for providing that answer to that question. I want to say that we are sadly at the end of our allotted time for today. If anyone has any further questions, you can email them to the Student Affairs Committee at Division 19 Student Rep at gmail.com. We really appreciate everyone participating and our three presenters for giving us their time. If anyone is interested in CE credit again, please provide your rank and discipline, if applicable, into the pod, or you can private message me if you don't want to announce it for everyone. And if you did not register, please include your email in that as well.
All right. Thank you, everyone.
Thank you.
Thank you very much, and thank you for putting on this today.
Thank you.
Carolina, are you still there? I could talk about that real shortly. All right, so it's not a rank. It's backwards in the mirror. This is our rank on our right collar. So they look very similar. They're slightly different, but they look very similar to the other services. And so lieutenant is what we call an 03. And on the left collar is actually not a rank. This is our corps device. So I'm staff corps. I'm not a line officer, so my collars are different. And my staff corps device is an oak leaf, which means I'm medical, and it has a twig on it, which means I'm medical service corps. So much like the Army, on your Class A's, you have caduceus, and then inside the caduce, it mentions what corps you are. So for medical service, it says MS. On the Navy uniform, the left collar also says that I'm medical service corps. But you're right on that. A lot of people confuse it or think we have two ranks. Or in the Marine Corps, especially, I've heard people call us Captain Major. Because their officer ranks are the same as yours, and it's just lost on many people. But it's not two ranks. It just tells that we're a medical service corps provider.